I'm Dr. Monica Bonakdar, and I would like to welcome you to this live educational webinar on hair restoration with Alma Ted. So here is the webinar format. I will first tell you about this new exciting technology called Alma Ted and go over many before and after photos. There's going to be 2 raffle giveaways valued over $300. Then I will tell you about the webinar exclusive offers, and those include a $300 free skincare kit from the makers of Alma Ted. And then we'll have a question and answer session where you can ask me anything you'd like. Before we start with Alma Ted, I'm going to tell you a little bit about myself. I've been practicing aesthetic medicine for about 20 years. I'm board certified with the American Board of Laser Surgery. I'm an Allergan Medical Institute faculty, and I train other physicians how to do Botox and fillers. You saw my Newport Beach practice in the intro video. I have 2 other practices, one in the desert and one in Inland Empire. Yes, I'm very busy, but I wouldn't be able to do it unless I had an amazing team of aesthetic superheroes. And my entire practice is focused on non-surgical aesthetics for the face and body. And I'm always on the lookout for the new game-changing lasers and devices like Alma Ted that I'm going to tell you about. All right, so hair loss or alopecia affects over 80 million Americans. In men, this number is about 50 million, and 95% of the male hair loss is male pattern baldness, as seen on the schematic. In women, this number is about 30 million, and by the age of 50, 40% of women experience female pattern hair loss. In men, going back to the men, by age 35, 2/3 of men will experience some degree of hair loss, and by age 50, 85% of men have significant thinning of hair. So hair loss does not discriminate. It's affecting both men and women. And let's now discuss the treatments that have been available so far. Surgical options started out by taking a strip of hair from the back of the head and causing a big scar in that area, and have now progressed to taking individual hair follicle units and implanting them where the hair loss is. This is either done manually or robotically, as seen on this photo. However, not all individuals want surgery. There's a significant cost and downtime to surgical correction, and it doesn't really address hair shedding or thinning. Non-surgical options up to now have included introduction of topicals or PRP or platelet-rich plasma to the scalp via direct needle injections or via indirect absorption after microneedling. This is a very tedious process that I have been doing for many years now, and it requires about an hour of numbing with topical anesthetics, a 20-minute treatment session that is still uncomfortable despite all the numbing that's been done. It takes an average of about 5 treatment sessions. There is downtime, including bruising and swelling, and also hair shedding due to trauma from the microneedles. Results are slow and limited, and results really are variable based on the quality of the patient's platelets for the PRP. Meet Alma Ted. This device has been FDA cleared in the US for hair restoration this year. However, the technology has been around outside of the US over 10 years and has been studied extensively for multiple applications, including alopecia or hair loss and skin rejuvenation. There are over 20 published studies on this technology. Alma Ted treatment is a combination of a special device and a special product. This treatment does not hurt, does not involve any needles, does not have any downtime, nor does it cause any initial hair shedding as seen with microneedling. TED proprietary technology handpiece produces acoustic sound waves and acoustic pressure that drive the hair care formula deep under the skin. TED hair care formula was created by the world-renowned Monte Research in Milan, Italy. Monte Research is a pharmaceutical lab that was founded in 1997, specializing in improving drug delivery and drug absorption. This proprietary formula is kept in a brown sealed bottle to prevent its oxidation until the time of use. It's been shown to slow down and stop excessive hair shedding, increase hair growth rate, increase blood flow and nutrient availability to the hair shaft, and increase hair anchoring and hair strength. This formula has been tested against PRP and many other hair compounds with superior results. The treatment, each session starts with transferring the TED hair care formula into a series of syringes used for applying the serum topically on the surface of the scalp without any needles. A one-time use applicator tip is affixed to the handpiece. The treatment zones are identified and marked on the scalp. Each treatment zone is primed for 2 minutes without the use of the serum to make the skin stratum corneum more permeable. Then the TED hair care formula is applied to the treatment zone topically without any needles. The formula is pushed deep into the scalp with acoustic waves and air pressure of the device gently moving on the surface of the skin. There's no pain. It's very comfortable. You may hear a low-pitched hum sound. The entire process takes about 30 to 45 minutes. Let me now show you the before and after photos. The results are impressive. Let me just start by saying that there were 3 initial physician investigators in the US who did a pilot study of 10 patients, and all 10 out of 10 patients responded positively to the treatment after 3 sessions 1 month apart. One of these investigators, Lady Di, that's her name, is now gone on to treat 1,000 patients, and she reports over 95% positive patient response and satisfaction. Results are seen as early as 2 weeks. So our first before and after, this man had balding in the crown of his head. These photos document his progress from baseline to a month after his first treatment, second treatment, and third treatment. And those are incredible. As already mentioned, the protocol includes 3 treatments 1 month apart. Some individuals may need 2 series of 3 treatments for the best results. I will be doing your consultations and telling you what it is that will help. And then we also get feedback from your own body's response after you return from your first treatment. Treatments are done on clean hair, and when you arrive to the appointment, your hair needs to be clean and dry. And after the treatment, you should wash your hair for 24 hours. These next 4 slides are of the same patient. In this view, we are seeing a whitening of her central part on her baseline, an improvement 1 month after the second treatment. In the next view, we see thinning and hair loss on her frontal hairline. And I think I got those mixed up. On this view, we are seeing the side of the hairline, and on the next view, we have the other side. Many times when the hairs are grown back, they are no longer gray and they're actually in original hair color. The next two slides are of the same patient and show improvement in the central hairline. And this slide shows improvement in the crown of her head. The next two slides are again of the same patient with devastating amount of thinning visible on the before photo and great improvement documented after just her second treatment. And here's another view with great results. So this next photo, your first thought looking at this photo may be that this patient has plenty of hair and doesn't need the treatment, but improvement is undeniable on this hair part. It just looks so much better on the after. Here's our last before and after, showing great improvement after only one treatment. Okay, so first question, yay, I'm back. The first question was, how many treatments do you need? This will be discussed during the consultation. On the average, it's 3 treatment sessions, 1 month apart. Some patients may need 2 series of 3 sessions, and we will definitely let you know what we think. After your initial series, then we decide on a maintenance of maybe once every quarter or once a year, depending on your hair and what stage of hair loss or hair growth it's in. Okay, what is our next question?
When do we start seeing improvement in our hair?
Results are seen as early as 2 weeks after the first treatment. So many of our patients, when they are returning for their second treatment, they're telling us that their hair shedding has slowed and they have little wisps of hair in the area that was treated.
Next question is, I have a very sensitive scalp that burns a lot. Is this an issue to do treatment?
Okay, for people with sensitive scalps, the product that we're applying, the hair care formula, is neutral pH, same pH as our skin, so you don't feel any burning, itching, tingling from the product going on the skin. I've had it done myself. And the actual device treatment, it feels like a low-pitched hum, difficult to explain, but it's not a high-pitched sound that you're like, oh my God, my ears, stop this. You kind of almost hear a noise and kind of don't. We haven't had any issues with scalp sensitivity. However, having said that, if I see someone and they've got an actual inflammation, infection, patch of something going on, that may preclude us from doing a treatment. So I will be doing a full-on exam before the treatment.
Are there any labs that should be done to rule out medical issues for hair loss first?
Labs for medical hair loss. It really depends on what's going on. If you are in your 40s, 50s, 60s up, and you're just noticing that your hair's not as thick as it used to be and there's like a gradual change, then I would say no. But if you all of a sudden come in and say, see, I have a circular patch of no hair, absolutely, we start with blood work.
And what are the statistics on losing hair after the treatment is completed?
Statistics for losing hair. So again, as I said, the device has been available in the US as of this year. There has been initial investigation pilot studies. All of that shows that there's improvement with the treatment, but it's not a cure. So if your genetic hereditary tendency is to continue to have thinning hair, we just move back the clock, and that's why the maintenance treatments will help for you to maintain what you've been able to achieve. And again, it really depends on the volume of hair that is thinned out or has fallen out. I may suggest a second series of 3, or I may suggest a maintenance treatment in 3 months or 6 months or 12 months. Next question, Liz.
That is it.
All right. Well, I'd love to see you in the office. Anyone interested, please let us know, and we will bring you in for your consultation and treatments. Thank you so much. I hope you enjoyed this webinar.